Hello everybody, I am Dr. Sanjeeva Rao Girimaji, consultant physician at Apollo BGS Hospital, Mysore. There is a lot of media reports, lot of information, lot of WhatsApp messages coming about the novel coronavirus or nCoV or nCoV that is being circulated, creating a lot of apprehension. So what exactly is this nCoV or this coronavirus? Coronavirus is a group of viruses that are known to cause common cold, cough, fever and all these symptoms. However, what happened was in the end of December 2019 from China, a new strain of virus was found to be infecting the individuals there, causing severe pneumonia, breathlessness, requiring ventilation and sometimes even death. This was different from the previously known coronaviruses, so they called it as the new coronavirus or the novel coronavirus. So what exactly is this? This was initially believed to have been transmitted from animals to human beings, but subsequently human to human transmission has also been suspected. There are a lot of patients who have been diagnosed, more than 5,000 as of date, with about 130 plus deaths having been reported. This virus can cause symptoms varying from mild symptoms like cough, fever to severe symptoms like breathlessness, sometimes even severe requiring ventilation. This virus has been documented to be transmitted. So far, this virus has been limited only to the China, with a few cases being reported from across the world, including USA, Canada, Germany, France, Nepal, Korea, Japan, Vietnam, and Sri Lanka, and many other places. However, all the patients that have been reported from these countries have had history of travel to China, especially the affected part of the China, and have returned from there. So far, there have been no endogenous case reported from any of these countries. So, what do we do? What precautions should we take? The first thing we need to do is that if anybody has the history of travel to China and returning back, presents with any of these symptoms, inform the doctor immediately. Make sure that you inform them that you have had a history of travel to China, you have just returned from there. Generally, the incubation period is said to be about 2 to 14 days. That means anywhere up to 14 days after the return, the patient may still contract the infection or may present with the infective symptoms. So during this incubation period, he is also potentially able to pass it on to others. So if there is a suspicion, the best thing is the patient should not mix with others, stay in a separate, well ventilated room, take precautionary measures, cover with a mask, then ensure that everybody in the household who attends to him wear a mask. You keep his utensils separately, wash them thoroughly with soap and water. Wash your hands every time, avoid direct contact, and especially make sure that when the person is sneezing or coughing, a tissue is used and the tissue is subsequently disposed of properly. So far, there has been no documented or proven medication to this virus, antiviral agent to this virus. Vaccines are being developed, but so far there is nothing in the market that can prevent this infection other than taking precautionary measures. So the best thing is, if there is any history, if there is any documented contact, please make sure that the infection is prevented. People who manifest with severe symptoms, especially with breathlessness, developing pneumonia, ARDS, require an intensive care, adequately equipped intensive care unit, need to be isolated, well ventilated, and supportive care, extensive supportive care is very important. So ensure that anybody who has these symptoms, inform their doctor and go to a setup where all these extensive ICU facilities are available. Any day, prevention is better than cure. Thank you.